Hello, I'm Alex Metricardi, Chief Marketing and Public Relations Officer for Living Branches. Today is Friday, February 4th, and I'm here today with Ed Brubaker, our Living Branches President and CEO. Hello.
Hello, Alex.
Nice to be back in our usual format.
Yeah, February 4th. Wow.
I don't know how that happened, but I will take it.
Unbelievable. But yeah, here we are.
Well, let's start with a recap of case counts. Luckily, we don't have quite as much to report as we would have a few weeks ago. But right now at Dock Woods, we still have 2 residents in Dock Terrace who are testing positive and 7 staff persons. And then at Souderton, we have 5 residents in healthcare, 3 residents in the villas, and 9 staff persons. And then at Willows, I believe we have 1 staff person who's getting very close to back to work. So those are significant improvements.
Oh yeah, they're way, way better than they were just probably 3 weeks ago. Because literally 3 weeks ago, we had more than 100 people out.
Yeah.
Now, I want to be clear, that doesn't mean they were all COVID positive. I think maybe 42 or 45 were COVID positive, but the rest had exposures because, kids are going to school, they're bringing it home. That's happening to a lot of our staff, that the COVID is having nothing to do with them or the level of safe precautions they're doing. It's because of the world continues to move on and things happen around them, school and other connections. So yeah, while we'd love to be, at 0, these numbers are really so much better than they were just a few weeks ago.
Yeah. And I think it's probably worth mentioning that we have seen, I think maybe in response to the fact that who knows how long it's going to be till we all get back to 0 again. We have seen some changes in guidance coming out with regard to how long people need to be out before they can return to work or to daily activities, what we need to do for quarantine. And so some of that's having a real positive impact on quality of life for staff and for residents.
Yeah, that's right. And the reality is, I don't know that we'll ever be at 0. The challenge about this, flu, for instance, pneumonia tend to be seasonal diseases. That's not to say people can't get that outside of the winter, but it tends to be winter. That has typically not been the case. It may drop in the summer or other times, but it can happen all year round. So we really don't know what's going to happen in the longer term, where the trajectory of the disease. I know, read about China having a 0 tolerance policy. That may or may not even be possible to do, and we'll have to find ways to live with it. But the flip side is, right now, whenever we get a case in healthcare, people that don't work in this industry really, in my opinion, have no idea. I mean, we have to put up zip walls. People have to put on PPE to go into the room. We have to, put meals on paper so they can the plates can be disposed of. There is so much more work, particularly in healthcare, but in personal care too. It's just a little different in healthcare because we still have a number of 2-person rooms. So then you say, what do we do with a resident? We have to move them to this room or that room. So the work that it takes to address this is just incredible, and staff have just done really good work on that. But for people that say, well, let's just let everybody get it and see where it goes, I'd invite them to come visit us someday and say, here's what it looks like if we just, let's let it spread. That is not a really good choice. And I would connect that to vaccines as well. We still are pushing for vaccines. That is still what we believe is the best way to get to the other side. Certainly having COVID could give some level of protection too, but we don't recommend COVID parties. I mean, that would just be dumb, in my opinion. But the vaccine really does make a difference. And we've had deaths in the last few months. But as of now, every one of those deaths from COVID has been an unvaccinated person. And it's really heartbreaking to see that. But that's the reality. So we want to continue to encourage people to get vaccinated so we can keep moving to the other side of this. Because as long as COVID has a host that it can infect, the potential of having variants continue to happen will happen. And it is just so draining for staff to have to go through these cycles. And this January to me was unbelievable, because last January we were full of hope in the vaccine, and our case counts were probably next to nothing. And then this January comes and it's like, what in the world happened? But again, we didn't attack it as quickly as we should have or could have. So we continue to encourage people to get vaccinated, but also to get boosted. Let's work together to get to the other side of this.
Yeah. And when you say we didn't attack it as quickly as we could have or should have, not us at Living Branches.
That's exactly right.
and that's the point
Society.
you're making.
Society.
Right. That's right. When people say, I'm not getting the vaccine and that's my choice, it is. But your choice definitely impacts other people.
That's right. And that's the thing that has kind of been, I'll just say it, has been amazing to me, because it feels like it's empathy. There's an empathy gene that may be missing.
Yeah.
Because I got my vaccine for me. Sure, I got it for me, but I got it as much for other people as for me. Some people would call me old, okay? I did.
I would not say that.
Oh, well, that's good, Alex. But some people would. My daughter or people younger than her. But the point is, I feel like I'm still relatively healthy, and I'm not terribly concerned about the disease. But I work in a place that we need to be concerned about it. So if I want to have empathy for my fellow human beings, sometimes I need to do things, right?
Yep.
That maybe I don't want to do, but I do them because it's for the good of the whole. And I don't want to get too philosophical here, but it just feels like we need some learning again in our culture. Mm-hmm. And we've often talked about how individualistic our society is in the Western world, and particularly the U.S. And I just think some of this is, let's work together.
Yeah.
Let's be together.
It's hard to overstate what an impact this had on staff.
Mm-hmm.
I mean, it certainly is challenging for residents, but it was just beyond exhausting. And I can't imagine how terrible it's been in the hospitals as well.
Yeah, that's right. I mean, my wife Lucy and I came in to help a few weeks ago and give out trays. And so maybe 2 hours we had an N95 on. And I said, how would you like to wear that 8 or 12 hours a day? And then I think the following week she volunteered in the testing team and, of course, had to wear an N95 and all that stuff. And she literally kind of got stuffed up because of that, and frankly ended up doing some rapid tests because she was going to go see her parents and was negative for COVID. But that breathing caused challenges. Now, it was an N95, not a regular surgical mask, but the point is it gave her new appreciation. And there's nothing like walking in somebody else's shoes to gain appreciation for what they're going through. Yeah. And I just hope we can continue to learn that muscle better in our society.
And if we're appreciating people, I think we should also maybe give a special shout out to our Souderton personal care and healthcare team members and residents, because not only are they dealing with COVID, they are also dealing with norovirus. So that's been incredibly difficult.
Yeah, that's right. And norovirus, in case you don't know, is a gastrointestinal thing. It goes through pretty quickly, which is the positive thing. But it wipes you out, and it is incredibly transmissible. I mean, incredibly. And so, yes, the last 2 years, we really haven't had that. Mm-hmm. But we have a lot more people coming in and out anymore. Yep. Residents are going in and out. And so we're going to see some of those kind of diseases again. And it was just heartbreaking to see them have to go through that.
Yeah, agree. Well, I have quite a few questions this week from residents. Everyone wants to know what's going on. So the first question we have comes from residents at Souderton. And they are asking, why do we allow staff to request a religious or medical exemption for the COVID vaccine? Obviously, we believe that the vaccine is effective, so why would we allow people to have an exemption?
Well, maybe the quick answer is because the vaccine mandate allowed for that. So you could either comply with the mandate by getting your staff vaccinated, a religious or a medical exemption. Now, I absolutely personally, and as CEO of Living Branches, believe that the vaccine is important, and I believe it makes a difference. But I also know that not everyone sees things the way I do. And we have people that have worked for us the last 2 years, some of whom haven't even gotten COVID. And who knows why? I really do think some people are maybe more susceptible than others for whatever reason that may be, just like any other disease, frankly. But we have people in those situations. I know of some who are not vaccinated and never got it, but they have been working equally as hard as anyone else. And so part of it is trying to be respectful of that, even though I don't agree with it. I'll be the first to say I don't agree with it, and I would say that to them. And in some cases, I have. But it's an option to allow us to still have some of those good employees. Does that mean we're going to stop encouraging them? Absolutely not. But it is a way that we can continue in a very tough employment environment. We can continue to see that. But I totally understand where that person is coming from. The quick answer is it's allowed for in the mandate. The follow-up is all the other things I talked about.
And maybe just to point out that we're starting back up with COVID vaccine clinics. And we're opening those to residents, staff, family, and even family members of residents. So if there's anybody out there who hasn't been vaccinated yet and wants to, check our website because there's information there.
Yeah, that's right. And the new language in CDC, et cetera, is up to date, not fully vaccinated, but up to date, which essentially means fully vaccinated really needs to now say boosted.
Yeah.
And so up to date means having everything you could in your situation. So if there's enough time elapsed since you got your vaccine to get a booster and you haven't gotten a booster, you would not be up to date. And so it's kind of some shifting of the language that's happening.
And I think it's worthwhile to point out that in our experience, we have seen that people who are boosted and got COVID had less of a reaction to it, if you will. They had fewer symptoms.
That's right.
In most cases, they had fewer symptoms than people who were vaccinated, or certainly people who were not vaccinated at all.
Yeah, that's right. And absolutely, people can always find a story of somebody that died or got really seriously ill that was vaccinated or even vaccinated and boosted. No question. There's always exceptions to the rule. Yeah. But when you look at it, which you need to, from the big picture, and that is to say, what do the stats say? Unequivocally, they say that people who are vaccinated and boosted are better protected and stay out of the hospital in more significant ways and do not have the same risk of death as persons who are unvaccinated. Yeah. Those are just the facts.
Yep, and we saw that.
That's absolutely correct.
Yeah. This question comes from the Doc Woods campus, and I have residents who are asking, there's been a lot of information in the news lately about face masks. Good, bad, what do you wear? And the question is, what do we recommend that residents wear for face masks?
Yeah, and one of the things that came up with face mask is that the cloth face masks, and I myself had some, eagles and Phillies and all that kind of stuff. I have some at home. But they were talking about the cloth face masks do not really provide good filtration. And this came up particularly with the Omicron variant. So like this, obviously we typically wear this unless we're able to separate physically appropriately for this interview. But we wear these in public spaces and Living Branches. This is a surgical mask, and that typically are 3-ply. And the thing with these is, what they talk about is you need to watch that they are tight enough here because things can come around and in the back. And so that's the big thing with the N95. They're a tighter fitting mask, and that's why people who work in N95s get fit tested because they test to make sure they stay tight to their face and does not allow filtration around that. So when you get fit tested, you are smelling something or that you shouldn't be able to smell because your nose is behind the mask.
Like a hood on
and then
your
you put a hood over you, and so if you can smell whatever they put in the hood, that means there's some type of filtration. So that's all that fit testing means. But that's the idea, to have a tight-fitting mask. So I would say for the general public, if you get a mask, like a surgical mask, that is decently tight-fitting, that's good. And N95, KN95s as well can be workable. But again, the idea is as tight to your face as possible so you don't have filtration around them. That's really the issue. With a cloth mask, it's really filtration through it. I've read that the surgical mask and the N95, there's probably not a huge difference between what goes through the mask. It's really about the tight-fitting properties of it.
It's what goes around
Correct.
the mask.
Now, with that said, I'm not going to say any mask is better than no mask, because cloth masks are probably not the greatest. But a surgical mask or an N95, just having someone wear them is better than nothing. I mean, I get a Wawa like anyone else or wherever, and there's fewer and fewer people wearing masks. Right now, you won't see me in a Wawa unless I forgot to put it on without my mask on. But a lot of people don't even wear them. So a surgical mask is better than no mask. But if you want to upgrade it, you could to an N95. But the tight-fitting nature of it is the most important. Yeah,
and I did read too, if you want to double mask, that is an effective strategy if you're putting a surgical mask on first and then a tight-fitting cloth mask. But they are recommending that you don't do double surgical masks.
Okay.
For whatever reason. I think, again, it gets to that question of fit.
Yeah, and the thing you were saying about the surgical mask first and then the cloth, all that does is push the surgical mask closer to the face to, again, avoid the gaps. But certainly at the end of the day, though, if someone who typically is not wearing a mask saying, which should I wear? I'm like, a surgical mask, wear something. But again, rather than a cloth mask. But surgical masks are very readily available again.
Question from both campuses. When can we have guests back in the Hearthside Bistro and the Apple Orchard Cafe? People are looking for us to open those again.
Yeah, and we're basically looking at the numbers. We had a high point of 30% positivity rate in Montgomery County. In my wildest dreams, I would have never thought we'd be there. I mean, we were less than 1% last August, okay? And that just means the number of positive tests in any given week. And so we're dropping. It's dropping now. But that's what's going on in the wider community is the biggest indicator of when we will allow guests in, because those guests live in the wider community. And the more you restrict your interaction with people in the wider community, or our residents too, who might be in the wider community, the more you restrict the number of people you interact with, the safer you are. So that really just comes down to that. So we regularly evaluate where those positivity rates are, where the rate per 100,000 is, infection rate per 100,000. So we look at all that stuff, and so that's what we will look at to determine when guests are allowed, because eating is one of the most unsafe things you can do because you don't have a mask on. And so that's when a lot of transmission can happen.
And one final question. This is from, I think, Doc Wood's family member. And she was saying to me, she read in the news that we are unable to get monoclonal antibodies, that they're not making them anymore. Could you talk a little bit about that?
Yeah, and there's always, it's not that they were saying untrue things on the news. It was just, there's always, who was it?
The rest of the story.
The rest of the story, and I can't pull his name right now. I'm thinking Ralph Nader, but
Paul Harvey.
Yeah, Paul Harvey. Ralph Nader. He was even further back. That was about the Corvairs. Unsafe at any speed.
Right.
For those of you who remember that. But what was happening was the monoclonal antibody that was being used for pre-Omicron was not as effective with Omicron. And so they were changing the monoclonal antibodies as to what they would recommend for Omicron. And there just wasn't as much of it out there. This is what I understand it to be. And so what was happening was there wasn't as much, and the previous was not as effective. But as far as I'm aware, I think we have a contact, a great pharmacy we work with, And when we have situations where we have residents who have had COVID or have COVID, we contact them. And I think in all cases, if they chose to get it, they were able to get it.
That's my understanding.
But the other thing to keep in mind, there's also a different grading system, if you will. Like, okay, is this person category 1 or 2 or 3, meaning the prioritization. And so depending on what their situation was, they may not have been as high on the priority, and so therefore may not have been as eligible for it. But again, those are the kind of the protocols that are used. But as far as I know, anyone who we offered it to and accepted it was able to get it to date.
Yeah. And it seems to have been fairly helpful again, because we really had a good number of people who were feeling much better by the time their 10 days of quarantine was up.
Yeah, that's right. So we feel it's effective. Again, we've used it for persons who were not vaccinated, and I know at least in one situation it did not help her. But that was a few months ago, actually, I believe. But yeah, it is available. But I don't know that like the average Joe on the street could call up CVS and say, I need the They might say, well, no, we don't have it. It's a little different when you're in the business we are and with the connections we have.
Yep. Well, that's it for my list of questions. Any final thoughts to share?
Wow, final thoughts to share. It definitely feels like we are at a different place, and we are at a different place than we were just a few short weeks ago. And frankly, we really don't know where this is going. And I would suggest that even the scientists that might be, ruminating about this really don't know.
Yeah.
I mean, they know much more about it than I do, but at the end of the day, nobody can really, with 100% facts, predict the future. I mean, just look at the weather. What a great job. You look outside and it says, oh, it's raining. I believe it's going to rain today. But so we really don't know, but we are glad that it's going down at this point in time. Does that mean it's going to stay down? We don't know. Does that mean we're at the endemic phase? We don't know. But I am so glad it's not what it was a couple weeks ago, because that was not sustainable for us in the long term. And again, we are most impacted by what's going on in the community around us. So if the rates are high in the community, the rates are going to go up here. If they're low, they're going to go down here. Those are the facts.
Yep.
So that's, I think, will continue to be the facts. We continue to encourage people to get vaccinated, to get boosted. We will do the best we can to open some things up again related to guests, et cetera, as it's safe to do so. But it's kind of like, hang in there, hang in there. And in particular with staff and residents, staff have just done superb work and under very difficult circumstances. So I really appreciate that. And residents have hung in there too, because it's just been more challenging to live and to enjoy life the last couple years. So I, for one, am hoping for a better tomorrow, and I believe it will eventually get here, but we don't know what the ups and downs will be before there. So I guess the word would be, hang in there. We're in this together. We'll get through it together. And thanks for your perseverance.
Yeah, everyone has really been, I think, doing the best that they possibly can in a difficult situation, residents and staff alike.
Yeah, that's very true.
Well, I think this might have been a marathon episode of our talk. So thank you to everyone who hung in until the very end. Again, if you have questions, please feel free to send them to coronavirusquestions@livingbranches.org or check our website, because we always have the most up-to-date information there. So thank you, Ed. Thank you, viewers. We will see you again shortly.